Hey, Renew Education case study again. This is a grid case. I would say this is a beginner case. However, I would say this spreads you into the skilled area for sure when it comes to number 13, but it's a starter on number 12. And I'll explain it mainly because of that sinus involvement here with this infected root canal treated tooth. I call this a classic because it is a case that is one of those scenarios where the doctor didn't have the tools available to restore this, meaning an implant in this scenario, and decided to not do a 3-unit bridge between the canine and the premolar, which would have probably have been a healthier scenario than this failing because of the recurrent decay between 13 and 14 because it's cantilevered or splinted here. The patient couldn't keep it clean. So all the kind of setups that we know maybe we shouldn't do, or maybe this depends too much on the patient and the oral hygiene, but we don't want to chop up a good tooth like the canine. This is the conundrum you're in. You're in this decision making of like, what do you recommend for the patient to follow your advice? And the patient or the doctor felt that they didn't like the idea of chopping up a good tooth to sacrifice for a bridge. So it's this classic dilemma that the doctor gets into, knowing that there's a compromise on the hygiene here, and it's compromised because it's a root canal treated tooth already to start. So this is dentistry. It's problem solving in a very custom way for everybody individually, and you got to make the best decisions possible. So let's look at the treatment assessment chart here. It's going to have pretty much a light green bone density, light green facial bone, red sinus, orange tissue scalloping, because we are in a premolar site, and you can look, and I'll explain that in a second, and orange lip line, mostly because when this patient smiles, you got a pretty big smile, and you start to see this. So maybe that's what the doctor was originally concerned about with that canine chopping it up. The one thing I'll note about the tissue scalping is you got a little defect here in the bone. The tissue sinks in a little bit, and you can cover that up pretty nicely with a bridge or a prosthetic like this. So you don't really have that problem, but you cannot cover that stuff up too easily when now the lip line or the gum line goes way up and it's in a cosmetic area, making this first premolar look a little longer than it actually should. So the implant here is going to make that tooth look longer than it typically is, as well as you might have a little bit of bone loss around this tooth here. So let's first look at the root canal treated tooth here and the sinus, and why this becomes more of a jumping stone into the skilled practitioner's level. And let's take a close look at that CT. So if you look at this CT, she's got good facial bone and that lingual wall's okay, but here's where the infection is, and it's breaking into the maxillary sinus. Here's your nasal sinus area, here's the maxillary sinus area, here's where that infected area is, in the base of the apical part of the root. You can see the root canal. You're going to graft this site. Now, you're going to extract this tooth. It's going to take a 2-bone healing event here for the patient. So you got to tell them they won't see this tooth for in the second premolar position for at least a good 8 to 9 months. Now, here's where you got the dilemma. When you take this out, that granulation tissue will pull a big ball out typically of granulation tissue, and you're going to have a very thin wall, if you even have a wall left when that comes out. Many times that soft tissue is all kind of connected to the membrane here, and you end up pulling it all out. These are not cases that you should just shove graft material in, because you're going to shove it into the sinus. So what you do is take, I have a tool it's a fairly long tool. It's in the sinus kit of the Hyoscine kit, and it's a fairly long tool that you have a blunt end to pack graft material with. So I take that first and kind of probe around that socket site down here at the apical end and see just how soft it is. If it feels pretty good, I will take a smaller blunt end instrument. I wouldn't take a perio probe, and I wouldn't take anything pointy like that, but something fairly blunt. And I want to feel that it feels kind of like a rubber band. I have some sinus tools. Sorry, I can't remember the name of them. You can get them from Salvin, and they have a little curved tip, kind of like a little bent spoon. That works well in this scenario where you can feel the membrane here or that cortical bone really delicately so that you feel this rubber bandy feel here. If you have that rubber bandy feel, you know that there's no bone there and that you better pack lightly everything you have that you can to save this bone height here. So that's kind of key. And then your tooth length looks pretty easy. It's probably a 10 once that's healed up. So that's a 12.2. So I expect you're probably going to do a 10, no longer than an 11.5 in this site. You got plenty of width, so that shouldn't be a problem either. So this is a really good case to start looking at what does the sinus membrane feel like? How do you judge that sinus? What does that feel? That feel is something that you develop over time. You want to have opportunities like this before you start doing sinus lifts. If you get opportunities like this, it's really nice to have so you can judge that for yourself before you start doing sinus lifts, crestal approach, whatever, that you're going to have to feel that kind of membrane that's there. Now, the area next door where the cantilever is a pretty nice site. Not super wide, and not super dense of bone, but I'm okay with that. That's what it looks like. So it's not so dense here. So what's nice about this as a starter one is once you break through that cortical layer, it becomes very easy to get that first initial burr in there, and you've got plenty of room to go. You have nice walls to deal with. And what I do here for teaching doctors how to kind of judge their angulation, especially if you're doing a flapless surgery in this kind of scenario where it just seems so straightforward, you can take a perio probe and pretend this is the tip of the perio probe. You know that this is the angulation of the perio probe is straight along the wall. You kind of rock it and you feel like, okay, I'm along the bony facial plate here. Now when you do your osteotomy, even if you're going in that angle, that's pretty darn good. Like if you just go parallel to that, you're not going to have a problem. So you're going to try to angle it a little bit away like that. So have a mental note. I do these measurements. I do these so that I could actually see what kind of subtle angulation that I'm going to do for the initial drill. And then, of course, you can take your x-rays for the mesial distal direction, but you can actually assess this a little bit more clearly by having a perio probe, and you got the right angle. So this isn't a difficult case. I like first and second premolars for doctors' first cases, and so this is a very welcoming starter situation for two reasons: the sinus and for an initial placement of an implant. So that's what we have for this case. Thanks for tuning in. We will be more and more trying to get our live broadcast up and going time to time, checking on our websites. And be sure to like us on Facebook and subscribe to us on YouTube. So we'll keep them going. Thanks a lot for visiting, and check out our other case studies as you can see.